give you a COVID update in a few minutes. We skipped last month somehow and never got back to it, so I'm 60 days since the last time. So this is the same format that I kind of run through before. Generally speaking, the news is all good over the last 60 days especially. So the chart on the left shows you the kind of the whole history of positive tests, positive patients cases in the state of Georgia. And you can see the long and the short lesson here is that where we are today, all the way out there on the far right, is as good as we've been since the very beginning stages. In fact, if your eyes are good enough, you can look down there. It's right about the time that it reached what we then thought was a peak, and we sheltered in place and took on all sorts of protocols and things, and we are back down to that level. I'm going to show you some other statistics about that in the future, but generally speaking, you can see that we kind of, if you call that earliest peak a peak, we had a second and then a third that was much more severe, and somewhere just after the first of this year is the high point, and we've been headed downhill since then for a lot of reasons, not least among them, of course, is availability of the vaccine. And the two charts on the right are the same numbers for the state of Georgia, and to the far right is DeKalb County. You see they track pretty closely, which is not a surprise, but you get a sense of where we've been historically with all of that. You'll recall that the biggest concern has always been, especially when the infections were much more widespread, would we have enough hospital beds and healthcare facilities to care for all the people who needed to be cared for, in addition to all the people who needed to be cared for other reasons. And so this was a real closely watched number. If you look closely, you'll see ICU beds in use, which was kind of one of the real primary concern, is at 76.8% of capacity, meaning we've got about a quarter of all ICU beds in the state available right now. And so that concern is much less than it once was. You'll also see the current hospitalizations by day. That's that wavy chart on the right. And again, where we are today is about as low as we've ever been. That dip over to the left was last June, just basically the month of June leading up to the 4th of July. We were at a low ebb. But those numbers have been coming down as well, so that's all in the good news category. This one on the left is a statistic that they track. This is the retransmission rate. It's a question. It's of some value. It's not absolute. It just gives you one more idea. It reflects a little bit of what's happened recently, and kind of assuming that momentum carries in the same direction. It's a little bit predictive. Basically, when it's 1, that means for every person who's infected, they're infecting one other person. So if it's above 1, that means infections are spreading. If it's below 1, infections are declining. And so at 0.91, we're in a good place there. That's almost a week old now. We've continued to improve a little bit since then. And the chart on the right is another one that's of some value, although not absolute by any stretch. This is the percent of positivity among people who are being tested for COVID. And so the target has always been to get under 5%, and you can see that we've ranged all over the place, but lately we've been under 5%. The trouble with this one is that this is not what they call surveillance testing, where they test a kind of a random group of people to see how many are infected or are carrying the disease. This is people who are going to get themselves tested, generally because they might have some reason to think they were exposed or infected. But anything under 5% there is good, and obviously better than almost at any time during the pandemic. I will tell you one interesting thing that I heard in the last week. The University of Georgia does do some surveillance testing, where they just get a certain number of students, whether they have any reason to think they've been exposed or not, to come in and be tested. Their positivity rate is something under 1% now. So on a random test of everybody who's just kind of wandering around out there, it's much lower than this, and that's a good sign as well. And this one has to do with vaccination rates. It's kind of new in the last several months since vaccinations kind of became widespread and statistics were reported. reported. Generally, well, you can see it there for yourself, and it's reported in different ways, but statewide, something upwards of a quarter of the population is now fully vaccinated, meaning they've had both if it was one of the vaccines that required 2 doses. There's another 8 or 10% who have had one and presumably will go on to get the other. There's been a lot of concern about that number has sort of leveled off. It's not going upward as fast as we might have hoped. I'm going to talk a little bit about why that is or isn't a big concern in just a minute. And the numbers on the right-hand side there are particularly for DeKalb County. You can see, I think we're probably doing a little bit better in the county than most of statewide, which is a good thing. And that one chart down in the bottom center talks about number of cases per million people by day and on a 7-day average, which is about as low as we've seen that number anywhere along the way. I want to share a different screen. Joseph, you're going to flip that over for me? This is something that I look at, a lot of people look at every day. This is from the state of Georgia, kind of cumulative statistics and daily reporting, some of the numbers and things. And so you can see there over all time, number of cases that we've had, deaths in the state, hospitalizations, and so on. Down below here, we get a report each day. So today's Monday, this is today's report, and it's yesterday's numbers being reported today. So they're very low. 370 confirmed cases, only 1 confirmed death, 8 hospitalizations. That's typical for the weekend, but not typical for a range of daily numbers. But one of the things I want to point out to you is this bottom line down here, this percent positive. I've got part of my screen covered up. I'm going to try to move some things around here. So you can see the total number of tests in all the time that we've been testing, the total number of positive, and across all that time, just a shade over 10% of tests have reported positive. And then you have a column of today's numbers for the same thing. This antigen is another form of testing that kind of came on about halfway through the pandemic and is kind of a quick way. It's another form of testing. And about 10% of those over time have come back positive. And then this last column is antibody testing, which is not exclusively, but generally it's somebody who is not aware they've ever been infected, but they want to know if maybe they were without having known it, or for whatever reason they might be carrying the antibodies and therefore hope to be immune or at least very resistant to the disease. So I want to talk about the vaccine and immunity, and especially herd immunity, because these are big topics lately. It's a little frustrating the way that they're being reported. First of all, let me be clear. I've had the vaccine. I recommend you get the vaccine. I hope everybody will consider getting the vaccine, but I understand there's a pretty large group of people who say they're not going to and they don't want to, and that's fine. I believe that's your choice, but we're going to talk about some of the repercussions of that. There has been another large group that they call vaccine hesitant, right? For one reason or another, they've been cautious and not wanting to get the vaccine yet, but they're open to getting it later. And some of those people have started to come around. Some wanted to just not be the first, right? I get that. They wanted to wait and see. They wanted to hear whether there was, besides all the testing that went on before the vaccine was approved, they want to see if in the real world there are good or bad or questionable outcomes and so on. There's been a lot of rumors and misinformation, bad information about things like making young men and women infertile and things like that have had them scared. I think the word's getting out that that's not true. In fact, sidebar, I'll just tell you that I heard on such a way to believe it from doctors in the past week that a young man is more likely to become infertile from having had COVID, much more so than he would be from getting the vaccine. Just something to think about. But what I want to say when I want to talk about herd immunity, it's been talked about since the beginning. We got to have 50 or 70 or 80 or 90% of everybody vaccinated before we have herd immunity. It's not exactly true, and this is Frank Auman. I'm not a doctor, but I'm going to give you my layman's version of my understanding of all of that. Herd immunity happens when enough of the population is immune to the disease for any reason that carriers of the disease don't have anybody to infect. So if you're in this room here and somebody walks in the door, if we're all immune, either by having had the disease or by having had the vaccination or by carrying around the antibodies, maybe from some source that we're not even sure how it happened, if for any of those reasons, someone comes in this room who's positive and we're all immune, that disease is going to die with that person because it has nowhere to go. That's herd immunity. If in this room there are 2 or 3 or 4 of us who are not immune, those are the only ones to whom that virus can spread. And so the more who are immune for any reason, the less chance the virus has to spread, and there's a little bit of an exponential effect of that as we get over 50 and 60 and 70%, the odds of an infected person encountering a susceptible person go down, and that's why we're seeing caseloads go down. And I just want to tell you, in addition to all the people who are vaccinated and or partially vaccinated, if you also take all the people who've had the disease, all the people who test positive for antigens, PCR molecular, all the people who test positive for antibody, that would overstate it. There's some overlap among those. But if you add all those groups together, you get a much higher number, a much higher percentage of people who, for one reason or another, are immune. And so I've been bothered by the way herd immunity has been reported, saying, well, we're only at 25% in Georgia and we're never going to get there and this thing's going to, no, it's not going to work like that. Not in my understanding. And so I just want to provide a little comfort and encourage you that you should get vaccinated, according to me. That's all I'm going to say. If you choose not to, that's up to you. You'll be the one person in the room who's susceptible when an infected person walks in. Maybe that's not a big deal. Maybe it's not a life-changing event for you. I hope so. But I want to encourage you. And by the way, I just heard today, I think, Pfizer's been approved for a much younger group of people, and so they're in the unvaccinated group. When we talk about 10.5 million people in the state of Georgia, they're in that group. Now they're eligible, and so that's going to help push our numbers forward too. So there's my COVID report for the evening.